So now next talk Dr. Kim. He will be speaking of the man versus machine, where we are.
Thank you, sir. And thank you again for your persistent way of making sure these meetings happen on a regular basis. And Dr. Subudhi has been one of the men behind driving teleophthalmology in the country. So thank you, sir. I usually talk about what we're doing, but I just wanted to talk about telemedicine, teleophthalmology, and AI as to where we are. Can you believe that this person, Dr. William Schwartz, mentioned this, that computing science will probably exert its major effect by augmenting and in some cases largely replacing the intellectual functions of the physician. And this was not mentioned now. If you look at the date, published in December 3, 1970. It's taken a long time, but the time is here now that where AI is playing a major role in medicine in many areas. So this was the first device, the IDX. The algorithm was the first one which was approved by FDA as any medical device in AI, using AI. So why do we need to apply machine learning to medicine? Because we really need to look at a lot of data and scanning the machines can crunch millions of data within a short period of time, and this can help in arriving or making decisions in many locations. So what can AI do? Basically today, this is what we are using: automate repetitive tasks, that is things I can do but are not good use of my time, and there aren't enough of me in the world to do them. So can AI do this work? So one of the most commonly used today where AI is used in ophthalmology is in screening for diabetic retinopathy, where the fundus images are taken by a photo or a camera, and then the images run through the algorithm like this. And it was supposed to be a video, how it within a few seconds, as you export this fundus photo to an algorithm, within a few seconds it gives you the grading as to mild, moderate, severe, or PDR as a diagnosis without any human intervention. So we have been doing this since 2001, doing a DR screening in all the diabetic clinics around Arvind, where we have trained the ophthalmic technicians, their technicians in the diabetic clinics or general physicians to take photographs. They send it to us, our retina specialist would grade them and then send a report back. This may take anywhere between 1 to 2 hours. We have been doing this since 2001, almost 22 years now. With the advent of AI, today the whole thing has been replaced. There's no dependency on humans in grading the images. Within a minute, less than a minute, the grading center or the diabetology clinic is able to get the report. And so this, irrespective of what time you do, it is available 24 bar all the time, 365 days. And what is important to see is this has gone through multiple validation processes before we deployed it in live situation, where we have seen with over multiple validation tests that were done, that these AI tool that we are using today, ourselves and Dr. Raji Raman from Shankar Nethralaya, we both have been working with the Google's team to work on this. There are umpteen number of AI algorithms today, and this is one of them. And it shows that many of them are better than the grader, better than the general ophthalmologist, and sometimes it's even better than the retina specialist, because it's one of the most important thing is it's consistent in whatever it is reading, and it's available 24/7. So we have been doing this this is 1 year's data, almost like we have looked at 200,000 patient eyes. And this is like previous year data. The numbers we see about close to 2,000 patients are screened every week at Arvind through different centers. So it's not just in ophthalmology, but it is working in many specialities of healthcare where AI is being used. This is in cervical cancer, in antibiotic discovery. AI is being used. And more importantly, in UK, there's a tool called the software called Babylon, which is doing a pre-screening or triaging the patients before they can have access to the National Health Services. So in some parts of the UK, they are using this so that only patients who have genuine problems reach to see the doctors. So health AI is definitely here. And what we see, the next part is, this is what is happening now, but what is there is that things that can come, that is things that I can't do, but what AI can do differently for me, where my brain alone is not enough. One of them is the prediction. Can you believe today we are able to predict whether the patient who has diabetes doesn't have diabetic retinopathy today? The AI algorithm, by just looking at the photographs, will be able to predict whether this patient can develop diabetic retinopathy in the next 5 years or 10 years. And this is not in live yet, but it shows that this is a possibility. So it's a matter of time before we have these algorithms coming in. We are working on this in one project where we are looking at just taking not fundus photos, just external eye photos using your smartphone. We are detecting many systemic biomarkers like GFR, EGFR, and hemoglobin, HbA1c are being detected just by taking external eye photographs. And this is something we are working on, and it's yet to be validated. We've already published 2 papers on this. One of them is the Lancet Digital Health. So there's a lot of things that are happening. In the interest of time, I will just... Digital twin in healthcare is another thing that's happening, where people are developing this to bring in, especially treating diseases in certain ways by developing this digital twin and working on how that twin will react to the certain treatments that you are deploying. In ophthalmology, just looking at the fundus photo, can diabetic macular edema. Today, you can't take OCT to the field. But if you can take a fundus photo and say whether this patient has got macular edema with the accuracy of an OCT, and that's happening now. And predicting responses after your anti-VEGF injection. Giving an injection and saying whether this patient is likely to improve or he's not going to improve even before you give the injection, just by looking at the OCT photos. Dr. Raji Raman is working with the Zeiss on this particular aspect, and we are doing some validation tests on this part of it. So just think about it. Even before many a times we will be able to detect only if the patient is responding or not after the treatment. But if you can say that this patient will respond to this injection, then it will save a lot of time for the patient and for the doctor. So there are a lot of prediction tools that are coming in. But what does it mean? There was another study that was done by in mental health. They used voice chat GPTs of different thing, which is voice enabled, and it was talking to those patients on mental care. And patients would ask questions and then this would respond. Patients did not know that they were talking to a machine. They were very happy over a period of time. And then when they found out that they were talking to the machine, there was a totally simulated empathy they feel is very weird. Can you imagine if the machine is telling no don't worry and stuff. So there's still a lot of negativity to this, but AI still can play a major role in how we treat patients with a lot of accuracy and making sure that we do not go other way, and ensuring that our pathway is limited in the way we treat these patients. So acknowledging the interdisciplinary evolution of healthcare, be optimistic, and it is not human and machine versus machine, it's human and machine. If we can use these machines to our advantage, I'm sure healthcare can be delivered in a much better way.